But you ever feel stuck when you're about to write something down? You know a less boring word for great, but the word just seems to have slipped out of your head. And in that moment, it's okay to check the internet thesaurus because technology and books are there to make life just a little bit easier for us. But there are some moments in life where we struggle to unstick ourselves. You have your heart set on a particular job and your father says you can't take it up and you have to go with something else now. Or you spent all weekend resisting the urge of not watching Griselda and you finished your assignment, but your boss still thinks it's necessary to point out your mistakes in a public meeting room. Bad days are a part of life, but sometimes those bad days can start to affect the quality of your life. And when I say that, I mean you find it difficult to get up, or you don't want to brush your teeth, or you don't want to talk to anyone. You are sitting and you don't know why, but you can feel your heart rate just going up. When we are in these situations, why is it so difficult for us to seek help to make life just a little bit easier? This is Sonali Acharji, and you are listening to Health Wealth, a podcast that hopes to leave you feeling better informed, but also deeply enthusiastic about making the right choices for your well-being. When I was growing up, if anyone acted strange or said anything quirky, then it was a very common joke to tell them that behave yourself or we'll send you to Agra's Pagalkhana, which literally translates to a madhouse, but we were referring to a mental asylum. And for most of us, the idea of a residential psychiatric care unit is a mental asylum. We think of it as a place where we send lunatics, those who are mentally unhinged, to be locked away from us. And this belief system has only been reinforced ever since movies got into the picture, pun very much intended. The imagery of people being tied down and electrocuted, or mothers being separated from their children, or people being forced to take medicine that they don't want to, all of it has sort of solidified an idea that a residential psychiatric hospital is a depressing and a very scary place. Unless, of course, you're a big fan of Harley Quinn. In that case, everything just somehow becomes extremely romantic and oddly sexy. But most of us do not want our lovers to fry up our brains, and we live in a country where just to go to the school counselor or the office counselor is enough for people to point at you and say, what's wrong with you? So why then would we go to a psychiatric hospital to be admitted for something like, say, a bad breakup or a sudden pink slip on the desk? Imagine my surprise when a friend called me up a few weeks ago and said, I'm having tremendous difficulty finishing my final thesis for my PhD. And she said she couldn't sleep at night and she was having panic attacks. So she was going to check into a psychiatric hospital. And I said, because you hope to find the love of your life and that will make everything better? And she laughed and she said, let me show you where I'm going. And she sent me these photographs. And these photographs looked nothing like the dark room with barren steel beds in my head. They actually looked a bit like a 4 or a 5-star hotel. It had wood-paneled walls and potted plants and frosted glass and modern art. Although I do tend to call anything with too many lines and no shape modern art. My artistic friends hate me. But anyhow, whatever it was definitely fancy art. And this series of images, they just got me thinking that, do I have the wrong impression about residential psychiatric hospitals entirely? And because I have so many impressions and some of them are so firm, my next thought was, I wish I had a psychiatrist to play true or false with. Thankfully, I do have a job where I can do just that. So, to help guide us through the realities, the services, and the requirements of an inpatient psychiatric hospital, we have with us today Dr. Navya Saluja, who is a psychiatrist with Sukoon Health, which is a chain of purely mental health hospitals, and they have clinics and hospitals across the country. Hi, doctor.
Hello, thank you for introducing me. And I really appreciate that we are coming somewhere and, we're going to talk about it.
Yeah. No, I'm really glad you came here despite all the rain and the threat of viral illnesses all around us. When I was growing up, I also had this phase when I thought I would like to be a psychiatrist. And, a friend looked at me and said, but you'll be talking to mental people. And I said, well, yes, most human beings have minds. So what is a mental person? What reaction did you get when you chose to be a psychiatrist?
There were very few friends who said, why you want to be a psychiatrist. You will also go mad.
Yeah.
There were people in my family who said this. But believe me, I have one of my best brothers. He's also a psychiatrist who actually broke the taboo about psychiatry. And believe me, when I say I wanted to become a psychiatrist, I don't say that. I say I am blessed to be a psychiatrist. It's a very, very beautiful journey altogether. Why? There are very few people now who understand the emotions. There are very, very few. And talking about emotions, talking about their mental health becomes a big, big satisfying job. So that is why I say I'm blessed. I don't say, okay, whatever you want to think.
Has it changed your way of relating towards people and the kind of empathy you have?
A lot. I was already very empathetic.
Yeah.
But now I feel that it has tremendously changed. Why? Because now you are able to understand what the other person is going through. When you've not seen the other side of the story, you never know what the other person is actually going through. But when you are a psychiatrist, you really know what the other person might be thinking,
Yeah.
We might be mistaken. I'm not saying that, oh, God has gifted me or I'm God. No. But you tend to understand a lot of things when you're sitting on the other side of the table.
So the idea of a therapist couch is still very, very new in India. But the idea of checking into a hospital for mental health care and staying overnight, that's almost unheard of. We'll gladly do that for a broken leg or any other infection, but we wouldn't do it for mental illnesses. So can you maybe start by telling us what is residential mental health care?
See, it is not that I'm talking about one thing. It is the holistic thing we are talking about, the quality of life. I am not talking about, depression, anxiety, XYZ. Yes, this is my job to do. But the person is actually suffering more than that. Checking into a residential facility is more to do with your quality of life, the person who's checking in. It's about talking about everything. Maybe your family, maybe your profession, maybe your social life. Whatever under the roof, I'm going to talk to you about it. And actually cutting out all the stimulus that you're receiving every day. So we are trying to shut that out and talk to you and understand you better.
And what are the sort of services that you would provide? I mean, is it just the therapeutic angle, or are you also doing behavior therapy? And I mean, what are the range of services that one can get?
To say you that, we provide everything. Under the roof, you have multidisciplinary team. You have at least 5 or 6 psychiatrists in the team, around 5 psychologists, 1 occupational therapist, 1 psychiatric social worker. Whatever under the roof you want, we'll help you out with that. So that is the range of things that we are providing you with.
And so my first thought, if I hear that, there is an availability of a residential psychiatric hospital, is what is the scale or the degree of problem that I need to have in order to avail this service, can I go for something as small as long as it's affecting my life? Like, say, for example, I've had a really bad fight with my partner, or, I'm struggling to sleep and it's affecting me beyond the usual. Is that enough? That just the degree of affecting or impact, if that's big enough, is that enough to go and check in?
So when we talk about this, I usually say when there's a socio-occupational dysfunction that the person is unable to perform, there are certain criteria where I would like to admit the patient, where there's harm to themselves or to others, or where they're generally not able to cope up with life. That is when I say, you need to get admitted. It's one of the severe problems that we get you admitted. It's not that, oh, now I'm going to check in. No. But it's going to be very, very severe when you're coming to a psychiatric residential facility.
So it can't be for smaller issues, can
No.
it? Can it be for insomnia, for example?
For insomnia, see, we have to rationalize drugs. So if you are benefited out of it, yes, please check in. If your doctor says, not otherwise, it's not in and out kind of service. It's not a hotel. It's more serious kind of issues that we are dealing with.
Yeah. And what happens? Like, can you walk us through the process? Like, for example, I come to you and I will tell you my problems. And you decide that it's severe enough at this stage that I'm a threat to my own well-being and I should check in. Then what's the process like?
See, I would like to interrupt you here. There are two kind of people. One, you coming to me, and the other is the family coming to me, where there's mental health capacity. Supposedly, you have mental health capacity, I will walk through the process. Now, when the family is coming to me, where the patient is not understanding that they are having some mental health issues, where the insight is not there, then we talk to the family. But we also say them to bring the patient along. Not that, I'm just because you say somebody is sick, you have to admit. No, we don't do that. I will first see the patient, will talk to him or her, make him understand. I understand at that point of time, he or she might not be able to understand what I'm talking about. But that is when we take them, talk to them, and tell them the entire procedure. So for anybody who's walking in, we would like to tell them, see, I will be your consulting psychiatrist. This will be your clinical psychologist. We'll have some yoga therapy sessions. We'll have physiotherapy every day. And depending upon the patient's condition, we add on to the art therapy and occupational therapy along with it. So this is how we kind of manage each and every patient. And the good part is that we also tell our patients that we have so many people in the center that we also discuss their cases. Supposedly, I am stuck. No human is actually perfect, right? So we do talk in our multidisciplinary team. Suppose I feel stuck. So I can obviously take guidance from my seniors or my peer group. What next can be done? What best can be done? That is what we do in a residential facility.
And supposing I find it difficult to do counseling at home, because there are a lot of people who are in environments which are a threat to their safety as well, abusive homes, for example. Can, if that person is working and has the means to afford, because let's be honest, it is a bit expensive right now to check in, but if they can afford and it would be safer for them to recover in a facility, is that an option?
Yes. Again, see, it depends how much insight you have, how much better you want to become. If you are in a condition where life is very difficult or the family isn't supportive, or you still feel that you can harm somebody, that is when I would say you. I have patients who check in for 1 or 2 days, maybe just sleep off and, talk to me or the therapist, and they check out. But the intensity and the gravity of the situation should be there.
And in that 1 or 2 days, they get that rest and break, which gives them the strength then to go back and implement what you're teaching them.
Yes.
Because often I find that's a bit of an issue with therapy. We, especially today with, social media therapists all over the place, everyone is learning the basic CBT or cognitive behavior therapy tricks. Everyone is getting some bits off the internet. And for even mild cases, like somebody who's not in a severe case, we do try to use those things. I like, for example, create your boundaries, or, look after yourself. We all know these buzzwords today.
Yes.
But you need some capacity, some inner strength to implement them also, right?
Yes, yes.
Can your facility provide that?
Yes. So now, see, I can actually take ideas about self and about my boundaries and XYZ. You don't have a human connection. I'm sorry. You can't build that. I am here, a psychiatrist and a psychologist's job is to build that kind of human connection, the rapport that we talk about. You can't get that on social media or talk about artificial intelligence. We are talking about artificial intelligence so much in the market. But I'm sorry. How will you get that emotional touch that is too much required, that you feel belonged? So that is very much important. Not, that I have thought of, okay, I can create myself boundaries and talk about XYZ, but no, that does not happen.
You mentioned artificial intelligence. Somebody told me that they're now having AI therapists. I personally can't think of anything more scary. But do you think the basics of therapy can still be given? Because AI would make it more accessible.
I understand your concern. We are running in millions as population. But where is the human factor? Why do you come for therapy? Why do you come and talk to a psychiatrist? Why can't you Google and take medicines on your own? No, I'm sorry. I don't promote AI because there's a lot of personal things. When you talk to somebody, you feel that. I'm talking about feelings. AI cannot feel my feelings, what I'm talking about. So I don't think that ways.
You mentioned that sometimes the person themselves can be in a situation which is so severe that they are harmful to their own well-being and they don't understand what's happening to them. We have, actually it sounds strange to say that, there are so many mental health severe disorders around as well. We've been talking so much about depression and anxiety, which exists, but so does schizophrenia, so does OCD, so does, the neurodiverse range of conditions, autism, ADHD. These are all, when the symptoms are pronounced enough, they can be really harmful and difficult to manage. Fears of, I think somebody was telling me that her brother was schizophrenic and they realized at the age of 44 because he always had a sense of paranoia. Someone's poisoning me or someone's stalking me. And they used to think that's just funny, that's just paranoia. And it started increasing and increasing. And eventually, after a really bad time at work, his capacity fell to such an extent that he couldn't even sit without thinking someone's out to murder him. In these cases, how do you help the patient reach a residential facility?
See, first we have to talk about mental health. There's a lot of stigma. I can reassure you, any 8th class student or 10th class student will know what sugar and blood pressure is. But nobody knows what depression or anxiety looks like. We are not talking enough. That is the major drawback of mental health. Pagal khane jana hai, something like that. Some madhouse or, the psychiatrist is also a mad doctor. Half of them think that ways. But believe me, this condition is so severe that the capacity of intelligence also goes away. Your cognition goes away. Now, talking about how to bring those patients, we have got even an elderly patient around 60 years old who is untreated throughout their life, having illness since 40 years, and nobody has recognized it. It's when they become unmanageable at home that they start reaching out to multiple doctors but not a psychiatrist. That is when they actually refer to a psychiatrist, and believe me, it becomes also difficult to treat. When you're reaching the facility at a later point of the illness, it becomes difficult to treat also. So first and foremost is to psychoeducate the family that these are the symptoms of the illness and make them understand that what we are looking at. It's not that we are trying to make money out of it, because half of them think that ways. It's not making money or minting money. It's more to understand what the illness looks like. And when they figure out that we are talking and, these symptoms are also present in their patient, that is when they actually start falling back to us, and they try and convince the patient to come to the facility and talk to the doctor first. And then we decide the goals.
Yeah. What if the patient is completely resistant, like paranoia disorders, where, they think that you will lock them up or harm them, and they're completely uncomfortable coming to the facility? What kind of intervention can one do then?
See, we have to psychoeducate the family. Again, they have to get the patient to the hospital. Or in Bangalore, like Sukoon, Bangalore, we do patient retrievals also. That supposedly I take the consent. The family has reached out to me as a psychiatrist. We take the consent from the family, and when it is very difficult for them, then we pick the patients up and bring to the centers. That is how we can treat them. In Gurgaon, Delhi, we tend to ask the patient or the family to come to the hospital. We can't afford to pick them up from the house, because then it becomes more of, you're kidnapping a patient or something like that. Once you are in the facility, we will treat you. We'll talk to you. First step is to talk to them, make them understand the importance of the medicine. What will happen? What chemical changes are happening if he does not, or if she does not take medicine? What wrong can happen? First process is talking. If they don't take medicines, then we give injections. It's one of the last stages that, I'm going to give injection. But I'm telling you, I've been in psychiatry since last 8 years. Most of them, 80 to 85%, usually have medicines once we talk to them. So it's a huge amount of number that take medicines after talking to them.
Yeah.
So it's a big thing.
I think the idea of psychiatric medicines, because in the beginning, there was so little known about how to administer them, side effects were more. People have not realized that, like with everything else, these medicines have also evolved. The way in which you administer them have also evolved. Because I know, for example, somebody was started on a class of antidepressants, serotonin inhibitors. And actually, India has one of the best prescribing modes, where we start with doses as little as 25 mg to get your body used to. In America, that's just unheard of. They would start you off with 50 mg and take you to 100 overnight. But we do have very responsible psychiatrists who really slowly increase your dose and get your body used to this new hormone. And that person didn't have any side effects whatsoever, not even nausea, which is very common. So for me, when I heard this, I was like, wow, it's not dependency inducing. It's so much of psychiatric medication. We have no idea the extent to which they have evolved and the extent to which the treatment has evolved.
I would like to add, see, when we are giving medicines, it's the initial stage. You are acutely sick. So treatment is also divided into different parts: acute, stability, and maintenance. Now, when I'm giving you in acute phase, obviously I'll give you a good amount of dose. First, your body has to be adapted to the medicines. It will be from lower dose, then to a higher dose. And once you are better, we also try to taper down the medicines. Nobody talks about tapering down of medicines, whatever I've heard from patients. There's a lot of myth that we'll be dependent on the medicine. But that does not happen. I'm telling you very frankly, I have stopped medicines for so many of my patients, and they're doing wonderfully well.
Yeah.
So this has to come out, that, it's not lifelong. Maybe it can be lifelong for some of them, but many of them do very well without medication also after they have got their treatment done.
Yeah, because I had a depression or anxiety. Let's talk about stress and anxiety, which all of us seem to have these days. So I knew somebody through my work. I met that patient, And she was having tremendous stress, and she was very resistant to the idea of medicine. So she was going for yoga and meditation, which is fine. Now, there the person is saying, calm yourself, breathe. And she used to come back and tell me, Sonali, I can't calm myself. I can't breathe. So, and then I took her to a psychiatrist who I knew, and that person was so lovely. He said, Beta, I'll give you the medicine. You learn to breathe, or you learn to get the capacity to breathe, then you learn to breathe. But first, the jaga to nahi hai. I mean, you need to have that basic foundation to calm yourself and breathe. And that's what the medication is there for.
Yes. And now there's a lot of talk. Any person, layman, would say you, oh, you are stressed, do yoga or meditation. No, you can't do yoga and meditation. When you have anxiety or depressive symptoms, it's contraindicated. Nobody's talking about that.
How is it contraindicated?
So when you're sitting down, you'll have a lot of thoughts in your head. And right now your brain is only thinking negative. It's not thinking positive. So there's now a load of 100 and billions of negative thoughts, and you're going to have another panic attack in some other moment. So no, it's contraindicated. For my patients who come to me for depression and anxiety, I don't give this recommendation. See, when they come to me, they've done their bits, 100 of things, and then they land up to psychiatrist.
Yeah.
And then they say, no, we've done yoga, we've done meditation, we've done this, we've done that, but we still don't feel comfortable. That is when I tell them, you can't do all these things.
Yeah. I've actually found it really interesting. There were these studies done, I think, in the UK. I forget the name of the journal it was in, but they were monitoring the cortisol or stress hormone levels of patients who had anxiety disorder as they did, one of these meditation apps. But because sitting in silence made their brain go on overdrive, like you said, the cortisol was shooting up. And if you could maybe explain a bit about cortisol and inflammation, because that's something I think all of us have right now.
So whenever you're not sleeping well, I'll come back to stress. Stress will not let you sleep. When your sleep cycle is not okay, your cortisol will also go high. See, anything in my body should be in an equilibrium kind of level, not more or not less. Anything in excess, maybe dopamine or my cortisol levels, is going to cause some or the other problems. Talking about inflammation, this chamber is not going to open up. Very frankly, God has made this chamber and it's not going to open up till the time you get a trauma. So now your body will start experiencing pains. Here and there'll be multiple vague pains in your body. So this is what cortisol is doing to your body, that you start having pain in your neck, shoulder, maybe in your hand. So somewhere you are actually going through some kind of mental health issues. So you need to check in with the mental health specialist. Rather than many people go to the physician, oh, our vitamin D is low, our vitamin B12 is low. So maybe you're low on that. But what about this? Who's going to treat this? You're going to function because of this. And now you don't want this software to get treated.
Yeah. You mentioned several times that the first port of call is a physician. Can you tell us, you did your MBBS. You are actually a physician as well. So can you maybe tell us what a psychiatrist goes through in medical training?
Okay. So I don't want to demean any other specialty. But when I'm actually doing MBBS, it's just a 15 days posting in psychiatry. I did not learn psychiatry in MBBS. It was when I actually had a postgraduate degree in my hand. That is when I learned, it is a serious kind of a thing. You can't joke about it. That is what you learn once you are in psychiatry.
But you did your 5 years of
MBBS.
Medicine, and
Yes.
all psychiatrists are also doctors.
Yes.
And how many years was your MD in psychiatry?
So, as I mentioned, I did diploma first, 2 years from Rohtak, and then I did MD from Assam Medical College for 2 years. So, almost 4 years of my education. Otherwise, if I would have taken a path of MD psychiatry, then it would have been 3 years.
But overall, you've studied medicine as a whole for 9 years.
Yes.
So that does make you very much qualified to be treating and giving out medicine just like any other doctor would.
Yes.
I think that's a misconception. A lot of people don't know the difference between a psychologist and a psychiatrist.
Yes.
The one is actually a medical
Doctor.
allopathic doctor.
So yesterday only, when I had a case, I was working till 11 in the hospital. So some if and but happened, and I told them everything is normal in your reports. But they did not want to hear me. They're like, you are a psychiatrist, how can you tell me my reports are okay? So I had to call the physician and, I had to calm them down. See, everything's okay. Even the doctor is saying so now. So you need a backup. Being a psychiatrist, that is what I feel as a dilemma. That, why you can't consider a doctor as a doctor?
I think people are confused between, we have too many psychologists and too little psychiatrists.
Yes.
In the country. Okay, I wouldn't say too many because we also don't have enough psychologists, but we definitely have more psychologists than psychiatrists.
Yes.
I mentioned I wanted to play true or false with a psychiatrist. I have a list of very common beliefs about psychiatric residential care. And I was hoping if you could tell me if they're true or not, and if they're not true, what is the truth?
Okay.
All
yes,
right?
I would also like to answer that.
Many people believe that patients will be isolated from their family and tied to beds in psychiatric hospitals.
No, not at all. Now we cannot tie anybody to the beds. Not at all. According to the new mental health law, if severity exists after I have given the medicine, now I cannot give more medicines. That is when I have to restrain the patient, and not more than half an hour I can do that. Second question, that you'll be isolated from families. No, not at all. Maybe initial 1 or 2 days, because we have to stop that kind of stress response or excessive response from your brain. Then we have to cut down all the stimulus from the environment. Maybe 1 or 2 days, but not that I'm going to isolate you. You need that kind of support from the family. So I actually prefer that family should stay with them, so that they feel that they're belonged. It should not be that, oh, I'm left alone. So no. And if they're absolutely okay, yes, the family can come and stay with them.
Many of the movies about psychiatric hospitals, the minute you enter, it begins with you being injected with something. Is that how it happens at your facility?
No, not at all. Yeah. Like I mentioned, we first talk. You need to also understand what the other person is facing, what the other person's pros and cons are, that I don't want to do this or I don't want to do that. First, you have to understand at his level or her level, and then go ahead. It's not that, oh, come, I'm going to inject you. No, not at all.
And do patients, particularly those who might be cognitively coherent, do they have a right over the medicines that you may or may not give them?
Yes, they do have a right. If they have a capacity, yes. But we also explain them, what is happening, why we have chosen this medicine for them, why is it particularly right for them. If they still say, no, I don't want to, yes, we can go with the trial that you want.
That residential care facilities are only for adults. Do you treat children?
Yes, under my treatment, I have a 13-year-old right now in the facility. So yes, we do treat children also.
Is it harder?
Little bit, because they have not understood what the world looks like and how the cognition should look like for them. So it is also very difficult for them to explain their things. So yes, a bit difficult, but not, I would say, as difficult.
Can someone, for behavioral changes like addictions, tobacco addiction, alcohol addiction, sex addiction, can someone check in for addiction?
Yes. A lot of patients, when they have that will that they want to leave, so we have a rehab specially for them at Chhatapur, that we have special addiction center where we treat them properly, so that how the future life could look better for them.
Yeah. Is residential psychiatric treatment the very last resort, or should it be the first?
It should be the first. It's not the last. It's just the beginning.
Is it a quick fix for all your problems? Like you give it money and you're guaranteed to be fine at the end of it?
See, money cannot solve everything. It takes time in psychiatry. You have been suffering for years and you want me to fix you in 10 days? No, that is not going to happen. It is going to take time. It's not quick fix, yes. Acutely, I can manage your symptoms very quickly. But see, it's life. I need to teach you and help you out how to go ahead.
And that can take time.
Yes.
So no matter how much money I give, I will have to put in the effort.
Without your efforts, it's not going to pay any bit.
Will residential psychiatric treatment make you dependent on that facility? How do you reintegrate with the world outside?
No. So when we are checking in a residential facility or a psychiatric center, we are wanting you to go out in the community and start working. We want you to be independent. We don't want you to be dependent on us. We want you to go and carry out your life as anybody else. Believe me, any mental health professional would be the happiest once you come back to your job and you're sustaining your job. We are the happiest.
What has made you the happiest so far?
Uh,
Anything you can remember?
There are many. I cannot even pinpoint one, but there was this person who was a chiropractor and he had some life events and he had started smoking cannabis, which led him to manic symptoms. And now he has come to us. He got admitted for a month. And can you believe me? We've stopped all the medicines for him and he's doing wonderfully well. There was this girl, believe me, the whole team did not think she could pass 12. And she's got 86% and now doing beautifully well. And we are now gradually reducing her medicines. So it's a big, big thing. Imagine where you just have an attack which nobody knows. And the family also does not know. And they are also panicking around you, oh, what has happened, what has happened. And now you see they're functioning so nicely that it gives you goosebumps when you talk about them. So, yes.
So the last one, I personally believe it is false, but for the sake of fairness, I'll ask you. And for the sake of the fact that you know more than me, can you get infected by someone else who has a mental illness? And somebody actually told me this, that if you go to a mental health facility, you might, it's not infected as in like an infectious disease, but if you see a schizophrenic, it'll trigger your predisposition for schizophrenia in you. So you might never be schizophrenic, but if you meet one, you will become one. Is that true?
No, not at all. I wouldn't say that. See, there is genetic predispositions, but some specific life event has to happen, or maybe it can happen de novo. But not like, oh, I'm seeing a psychiatric patient and I should also be a psychiatric patient. No, not at all. We all have very different challenges, believe me. Maybe I look very young, but everybody has different challenges in their lives. So you can't compare. I cannot compare my life with you. I cannot compare my life with my fellow psychiatrist.
Yeah.
So no.
There's a lot happening now, which I find very interesting. Someone reached out to me about sports psychiatry, especially right now with what's happened at the Olympics with Vinesh Fogart. The importance of psychiatric care for athletes. Can you maybe expand a little bit on that? Like, why would a sports person or profession-specific psychiatric care, why is that important?
See, we are all in different fields of profession. And believe me, if I say I'm a doctor, my life is a tough one. No. Now you see everybody is functioning at 100 or maybe 110. So everybody is going through stress in their entire life or entire span of that profession. So that is where you need somebody to talk to you about it. That, we have to look at different domains of life, not only to one domain that, maybe sports or maybe any profession.
Yeah, because it does sound extremely traumatic, just seeing those visuals coming in from the Olympics of, staying up all night and trying so hard and then failing at it. It does make sense that when we are talking about HR teams or human resource teams, that we then also now think to include a professional psychiatrist, not a psychologist, but a medical doctor.
See, any breakdown can happen. We are being judged every second, and somebody going and representing the country. It's not now only India. You're talking about everybody in the world. So, do you understand the impact that I can face? Maybe I'm a sports player, but I am just as human as you are. So, I can have that emotional breakdowns anytime. So, that becomes very specific. Now, we talk a lot in terms of specific things. So, now your emotional health becomes an issue. And if that becomes an issue, you are not going to perform. That is the reason that we talk about a mental health professional in that team, so that you can actually talk about what you're going through.
And if it's severe enough, you get the support that you then need.
Yes, yes. And obviously, you're going to meet that person regularly. So the repo is very, very strong.
Yeah. My last question, actually, as a conclusion, we have very, very few residential hospitals for mental health. Most of the larger hospitals, while they do have inpatient facilities, they will not be admitting certainly those with severe mental disorders. Why do you think, I mean, if you could give me an argument as a psychiatrist, what would you say as to why we need to really consider building infrastructure for mental health hospital care?
Again, see, I being MBBS, very frank, I did not read psychiatry in my MBBS. So I don't know about psychiatry. I would say only 20%, or maybe, I'm sorry, 20 is too large as a number, 2% of us are psychiatrists in that whole group of doctors. There's a lot of stigma regarding mental health problems. We need to learn more and maybe visit more psychiatric hospitals and understand how we function. That is when, we will understand how to collaborate a mental health facility to a larger center. We think, oh, this patient can do this, patient can do that. Believe me, no. That patient will not do any harm. But a normal functioning person can do more harm than my patient can do. So we need to be more understanding and we should learn about psychiatry. That is when the stigma will break down. It has to come down from the top level rather than going from down to up. So that is what I feel.
Yeah. Thank you for sharing everything. Hopefully this will help remove some stigma. I personally don't even like the term mental health. I would call it health. Why? Some people say mental health is invisible, but I'd like to ask you, can you actually see high blood pressure or diabetes or cancer? I mean, yes, you can see the symptoms of it. And to that extent, you can actually see the symptoms of mental health illnesses. You can see it in tears. You can see it in hands which are shivering. You can see it in eyes that haven't slept. You can see it in the WhatsApp status of a social media fan that now says last seen 1 month ago. You can see it in increasing number of cigarette and whiskey packets in the garbage can. You can see the effect. And when you go through these kind of situations, you deserve the right to support and health. So for an essential support system like psychiatric care to then be put into the goods and services tax bracket of 18%, which is the same as what you would pay for if you were getting a candle wax pedicure or renting a banquet hall for Teddy Bear Day, means you're making psychiatric care extremely unaffordable and inaccessible for a majority of people. And yes, Teddy Bear Day does exist, and yes, people do rent banquet halls to celebrate it. My nephew recently showed me a picture, and it had the words, "For change, you need chaos." And so perhaps those of us who do understand that access to universal healthcare means access to all kinds of support for all kinds of health challenges. Perhaps we need to speak a little bit louder. Because if we don't and we stay silent, then the predictions of the impact that ignoring mental health conditions will cost our economy and our society is far, far scarier than anything that's come out of Alfred Hitchcock's mind. Have you ever been to a residential psychiatric care unit? And were your family and friends supportive of it? And what's your favorite filmy psychiatric ward scene? I'd love to hear about your health experiences and thoughts. You can write to us at pods@indiatoday.com, or you can message us on 8588966996. And if this episode was fun, relatable, and shed new light on unfair taxation, then please leave us a good rating. We are there on Spotify, Apple, and YouTube Music.